I want to start by talking about something that most people deal with regularly, but almost nobody discusses openly. You haven't gone in a few days. Things feel blocked, uncomfortable, sluggish. Maybe you've tried drinking more water. Maybe you've reached for something over the counter. Maybe you've just waited it out and hoped for the best. And somewhere in the back of your mind, there's a quiet worry. Is this normal? Is something wrong? Should I be doing something different? If that sounds familiar, I want you to know two things right now. You are far from alone. The National Institute on Aging reports that about 1 in 3 older adults experiences occasional constipation symptoms. 1 in 3. This is one of the most common health issues in people over 50, and it is also one of the most undertreated, because people are embarrassed to bring it up, and because the advice they do receive is often incomplete. And here's what I want to build toward today. There's a connection between constipation and certain medications that the majority of older adults are completely unaware of. A connection that may explain why a problem that started gradually has become persistent. Despite the fact that diet and hydration haven't changed dramatically, that connection changes the entire conversation about what to do next. Stay with me. Let's start with what constipation actually is. Because there's a belief many people carry that causes unnecessary distress, and that the research directly contradicts. Many people believe they are constipated if they don't have a bowel movement every single day, and when a day passes without one, they worry. They reach for a laxative. They feel like something has gone wrong. The NIA's guidance is clear on this. There is no right number of daily or weekly bowel movements. Being regular means something different for each person. For some people, twice a day is normal. For others, 3 times a week is perfectly healthy. What matters is consistency for you, and whether the pattern has changed significantly from what has been your norm. The actual indicators of constipation worth paying attention to are fewer than 3 bowel movements per week, difficulty passing stools, hard or lumpy stools, or a persistent feeling of incomplete emptying. If those experiences are frequent, that warrants attention. A single difficult day does not. This reframe matters because unnecessary anxiety about bowel habits and unnecessary laxative use driven by that anxiety creates its own problems. Understanding what constipation actually is helps you respond proportionately rather than reactively. Now let's talk about causes. And this is where the picture becomes significantly more complex than most people realize. The common causes that most people know about are diet and hydration. Not enough fiber, not enough fluid. These are real contributing factors. Fiber gives stool its bulk and texture. Water helps fiber do its job. Without adequate hydration, even a high-fiber diet can result in harder stools that are more difficult to pass. And when diet is low in both fiber and fluid simultaneously, constipation becomes almost predictable. Physical inactivity is the third member of this trio. Movement, walking, any consistent physical activity stimulates the muscles that move stool through the digestive tract. Long periods of inactivity, whether from illness, recovery from surgery, or simply sedentary habits, slow that movement significantly. This is one of the reasons that constipation is particularly common during periods of reduced activity, and why resuming movement after those periods tends to help. Changes in routine, travel, altered meal timing, disrupted sleep can also trigger constipation in people who are otherwise regular. The digestive system is more sensitive to routine than most people appreciate. Disrupting the schedule disrupts the system. These lifestyle factors are the ones most commonly discussed, but they are not the complete picture. Here's where most people get it wrong about constipation after 50. They focus entirely on diet and hydration, eating more fiber, drinking more water, while never examining a factor that may be driving the problem just as powerfully, or more so, their medications. The NIA's guidance specifically identifies a significant number of commonly used medications that can cause or significantly worsen constipation. This list is worth knowing in detail because it includes drugs that many older adults take every day, often for years, without connecting them to digestive symptoms. Certain antidepressants can slow bowel motility. Antacids containing aluminum or calcium, common over-the-counter remedies for heartburn and indigestion, are a frequently overlooked cause. Antihistamines, used for allergies and as the active ingredient in many over-the-counter sleep aids, can contribute. Certain pain medications, particularly opioid-based ones, are among the most potent causes of constipation and often require specific management strategies. Some medications used to treat high blood pressure, diuretics, and several other drug classes also appear on this list. Dietary supplements are not exempt. Iron supplements, commonly taken for anemia, are a well-known cause of constipation. Anesthesia used during medical procedures can disrupt bowel function for days or even weeks afterward. And this is why doctors rarely explain this clearly enough. Each medication is typically discussed in terms of its primary purpose: treating depression, managing blood pressure, relieving pain. The digestive side effects may be mentioned briefly or included in a long list that's easy to miss. Nobody sits you down and says, the combination of 3 medications you're taking may be why your digestion has changed significantly over the past year. If your constipation has become persistent, if it developed gradually alongside changes in your medication regimen, that connection deserves to be brought to your doctor's attention explicitly, not to stop any medication without medical guidance, but to have a full conversation about what's happening and what options exist. There is also a category of medical conditions that can cause constipation directly, and that matters specifically for older adults because these are conditions that become more prevalent with age. Disorders that affect the muscles or nerves involved in bowel movement can significantly impair digestive function. Parkinson's disease, stroke, and spinal cord injuries all fall into this category. Conditions affecting hormones or metabolism, diabetes in particular, can slow the digestive system. Pelvic floor disorders, certain gastrointestinal conditions like irritable bowel syndrome, and in more serious cases, tumors or blockages, can all produce constipation symptoms. And the NIA specifically notes that people living with Alzheimer's disease or another form of dementia may be more likely to experience constipation due to the effects of the disease on diet, daily habits, and physical activity. We discussed in earlier videos how constipation can cause behavioral changes in people with Alzheimer's. This is the other side of that connection. The disease itself contributes to the digestive problem. The reason this matters is that persistent constipation always warrants a medical conversation, not to create alarm, but to ensure that an addressable underlying condition isn't being missed while you focus exclusively on dietary changes. Now we arrive at the section of today's video I want you to stay for, because everything we've discussed so far is important context. But what I'm about to share is the practical insight that most people miss, and that explains why the standard advice about fiber and water sometimes isn't enough. Fiber works differently depending on fluid intake. This is not a fine print detail. It is a fundamental relationship that changes how you approach both interventions. Dietary fiber absorbs water in the digestive tract to create soft, bulky stool that moves easily. When fluid intake is adequate, fiber functions exactly as intended. But when fluid intake is insufficient, fiber can actually worsen constipation because it absorbs what little water is available, creating denser, harder stool rather than the soft, movable kind. This means that increasing fiber without simultaneously increasing fluid intake is not just ineffective, it may make the problem worse. The practical implication is that fiber and hydration must be addressed together, not sequentially. If you've added more vegetables and whole grains to your diet and things have not improved, or have actually gotten harder, the missing piece may be that your fluid intake hasn't kept pace with the increased fiber load. How much fluid? That question has an individual answer depending on body size, activity level, climate, and health conditions. Your doctor or a dietitian can give you a specific target, but the general direction is more than most people drink when they're not specifically trying to hydrate, and spread consistently throughout the day, not consumed in large amounts at one time. Let's also briefly address over-the-counter options, because this is an area where people frequently make choices without adequate information. There are several categories of laxatives available without a prescription. Fiber supplements add bulk to stool and work best with adequate fluid intake. Stool softeners draw water into the stool to make it easier to pass. Osmotic laxatives pull water into the colon to stimulate movement. Stimulant laxatives directly prompt bowel contractions. Each of these works differently and is appropriate for different situations. Using the wrong type, or using any laxative regularly without understanding why constipation is occurring, can create dependence and other complications over time. The NIA's guidance is clear that your doctor or healthcare provider can help you decide which option may be appropriate for your specific situation. This is a conversation worth having rather than navigating alone through the pharmacy aisle, particularly if constipation is persistent, if you're on multiple medications, or if you have other health conditions that may affect which options are safe for you. Let's bring everything together with practical actions. The first is to reassess what normal means for you and measure against that, not against an arbitrary daily standard. If your pattern has changed significantly, that's worth noting. If it hasn't changed, and you're simply on the less frequent end of the normal spectrum, the anxiety itself may be driving more stress about this than the situation warrants. The second is to address fiber and fluid together as a package. More vegetables, fruits, whole grains, and high-fiber foods, alongside meaningfully increased water and fluid intake throughout the day. These two interventions are interdependent. One without the other produces incomplete results. The third is to move daily. Walking, any consistent physical activity. This is not separate from constipation management. It is part of it. The digestive system responds to physical movement. Building consistent daily activity into your routine addresses constipation from the inside out and supports overall health in every other way simultaneously. The fourth is to bring your complete medication list to your next doctor's appointment and ask directly, could any of these be contributing to my constipation? This includes prescription medications, over-the-counter drugs, and dietary supplements. Ask for the complete picture. That conversation may reveal something specific and addressable that no amount of dietary change would solve on its own. And the fifth, if constipation is persistent, if it's accompanied by pain, blood, significant bloating, or other symptoms, or if nothing you've tried is working, talk to your doctor rather than continuing to manage alone. Constipation is usually not serious, but occasionally it is a signal of something that needs clinical attention. Bringing it to your healthcare provider promptly when the home strategies aren't working is the right call, not an overreaction. Here's what I want you to carry with you from today. Constipation after 50 is common, often uncomfortable, frequently misunderstood, and in most cases, genuinely manageable once you understand what's actually driving it. Diet and hydration are real factors. Physical activity is a real factor. Routine matters. And medications, the ones many of us take daily without question, may be a more significant contributor than most people have ever considered. Understanding the full picture gives you real options, not just the generic advice to eat more fiber, but a targeted response to your specific situation, informed by an honest look at everything that's contributing. You deserve that level of clarity. Your digestive health is part of your overall health, and your overall health is the foundation of everything else you want to be able to do. Don't be embarrassed to ask your doctor about this. Don't manage it in silence. And don't accept persistent discomfort as simply the price of getting older. It doesn't have to be. Before you go, here's something I want to plant in your mind for our next conversation. We've talked today about constipation as an isolated issue, but there's a broader topic that connects constipation, bloating, appetite changes, and several other digestive concerns that become more common after 50, and that connects all of them to something most people would never think to look at. It involves how the gut microbiome, the community of bacteria living in your digestive system, changes with age, and how those changes affect not just digestion, but immunity, mood, and cognitive function in ways that research is only beginning to fully understand. That's coming up next. And if you want to keep getting clear, research-grounded, genuinely useful guidance on the health topics that matter most as you age, subscribe to this channel. Take very good care of yourself. Your body is worth understanding clearly, and now you understand it a little better.